infrahyoids. Oh, hold it.
Thank you. Put this down.
So how do we do that? We find that thyroid notch. Right there's the notch. We can't go below that notch because that's going to get on our infrahyoids and pull this down. Okay? Electrodes should never touch. They should run parallel and they stay under her mandible. Plug them in. All right. It's Jill, right?
Yeah.
All right, Jill. Here's what you're going to do. Tell me when you feel a tingle. Just a sensory stim, right? We're just going to get a tingle first.
Yeah.
See how her spine straightened up?
Yeah.
Yep.
Yeah.
All right, Russ.
Slouching.
All right, Russ. Now it's serious because now I know what's going on.
Yeah.
All right, now here's the rule. Take as much as you can. The more the better. But if it gets uncomfortable, you don't like what you're feeling, we just stop. When I'm done, it will stim you for 5 seconds. So let them see if we get a motor contraction, let them film it, and then I'll tell you what we do when it comes on the next couple times. So here we go. Take as much as you can, the more the better. Okay, we just went up a couple. I'm not seeing a much going on right now. I just want to make sure you're comfortable.
Yeah.
Still feels okay?
Yeah.
Can you take a little more?
A little bit more.
All right, here we go, slow and easy. I'm gonna go up a little. There, it's starting to come.
Yeah.
I just went up one more, right there, just went off.
Yeah.
Can you take a little more?
Just a little.
All right, I'm gonna go up real slow.
Okay.
We're only going up one at a time.
Okay.
Okay, so nice and easy, just relax. Watch right here, you're gonna see it come on. Here it is, 2, 3, 4, 5, and it just went off. All right, did you feel that? Now, how are we doing?
Yeah. All right.
You
Okay.
think you can go one more?
Go on then.
God bless you. You don't know. Your patients won't know. But this is a treatment over time. 30 minutes, you're going to do it on a daily basis. They'll get used to it. Here it is. 2, 3, 4, 5, and off.
Yeah.
Now, that's enough. Because you see how she's starting to say it. Now, here's the last thing you're going to do for me, Jill. Next time it comes on, try to swallow. Wait till it gets there. Give it a second to get there, and I'll tell you when to swallow. You ready? All right. It's on for 5 seconds. Now swallow. Beautiful. You see how you were able to overcome that?
Yeah.
Now let me ask you, did it feel effortful? Did you feel like you had to do a little extra effort to swallow? I would agree. The only reason I would say she was a little effortful is she did this. She kind of leaned into it. So what are we doing? So I'm going to do this so you all can see. Are you okay with this, Jim? So there's a person at rest. We know when you place electrodes under the chin, you can get to these suprahyoid muscles. Now, all we're saying is we're pulling that hyoid forward and upward. Now, based on anatomical inference, think of it as a rope. You can affect the kinetic chain all the way down. So if I pull the hyoid forward and upward, guess what? My tongue attaches to my hyoid. So now I get tongue-based retraction because it's not stimulating the tongue. I'm not stimulating Jill's tongue, but by pulling the hyoid forward, the tongue's got to follow. Your epiglottis sits inside your hyoid. So as I pull her hyoid forward and upward, what does the epiglottis got to start to do? It's got to start to tilt back. Here's why it works. This is what we do better than anybody. We pull the airway open. And that's counterintuitive to what you guys are trying to do, because you know when we pull the airway open, we're going to increase penetration or aspiration. But what are we not going to give her? No bolus, no food. That's a huge difference. And now what are you going to have Jill do? Swallow, because when she swallows, guess what she's going to do? Shut it. And that's the intrinsic resistive exercise you could never get with anything else. And now I'm working the type 2B fast twitch. The only way you work type 2B fast twitch is when you fatigue a patient. So how many times have you exercised a patient with swallowing disorders and you maybe got them to do 10 or 20 swallows in an hour or 45 minutes? You've never worked them hard enough to work the type 2B fast twitch. As soon as I elicited motor on Jill, as soon as you saw those muscles tighten, we worked. Those are type 2Bs because they respond to electrical stim faster. That's why you would use electrical stim. Realize we are not stimulating a swallow. We are stimulating motion that affects the kinetic chain all the way down the throat. And if you don't believe me, it's in textbooks now that we can now take it all the way down to the PES-UES. This is in Japan. They get it. They get it. They're saying, look, at rest, Russ, you say you just move the hyoid. No, we affect the hyoid. And guess what happens to the vallecula? It gets shallower because the epiglottis starts to come back. What happens to the airway? We're pulling it open. What happens to the PSUES? It gets stretched or pulled open, or it relaxes because of the anterior motion. Now all you got to get the patient to do is swallow. Because the best exercise for swallowing, y'all, and it's this with paired swallowing, make it more effortful. And if we need to, we can add this and make it even more effortful. A chin to chest with a swallow. Make sense? Questions?
Thank you.